Hi, in this video, I want to talk about recovery time for total knee replacement. Hi, welcome back. This is Elbu, your exercise physiologist. And I've been questioned quite a few times about the recovery time after a surgery. This is some things that people tend not to talk about because of the time frame. People tend to not go for surgery, and sometimes surgeons don't even tell you. So, depending on how you look at it, recovery time to me typically takes about 4 to 6 months. A few things that comes into play because they are the factors basically that determines how fast you recover. First, your surgeon. If your surgeon is good, he did a good job, your recovery will be a lot faster. And when I say he did a good job, meaning that when he cut you open or when he go in to do some of the things, we have to make sure that the muscles are not too tight, or when they do the replacement, there's no accident that happens. So this is just one factor, your surgeon. Second, the person who helps you with your rehab. So this is the part where I say, to me, it takes about 4 to 6 months, depending on how you look at it. If you were to take pain versus no pain as your fully recovered, then sometimes maybe even 2 to 4 months. To me, a good knee has to be functional. If it's not functional, it is not considered fully recovered. So I have a high standard. I set it to 4 to 6 months. You want to make sure that you have a knee replacement. Okay, now something is new in there. You don't want to screw it up again because you don't want to have a second knee replacement, which most of the time you wouldn't need to. It's just how diligent you are doing your rehab, your conditioning work, and your strengthening work. Okay, so let me draw for you. Okay, so over here, just some kind of graph so that you can understand why I say a lot of things depends. So let's just take it that we have somebody who has done their surgery, right? A total knee replacement, and that would be the first day from there, right? So it will be from here, first day, right? So when you just done with your surgery, it will take a few weeks for you to start realizing that there's no pain, right? So there's a few things that you can do. There's actually very little that can help you speed up the process, because that will depend on, first again, the surgeon and how fast your body recovers. So during that part, you'll be taking a lot of painkillers, you'll be taking a lot of icing, you'll be doing a lot of icing just to make sure that the swell is kept down so it doesn't swell up. So a lot of things to manage the pain. And when you feel no pain, this is the part where you can start doing some form of exercises. Usually for a start, you will need to be doing some form of stretching because the muscles are very, very tight because you haven't been moving much because of the surgery, right? So that's the number one thing that you need to do, a lot of stretch. And once beyond that, you have your full range of motion. Or when you're doing your stretch and you kind of just testing a little bit here and there, and if you start to feel pain, then you may want to hold off a little bit first, because you may be rushing into things. So if you're doing some movement and you feel pain, you may want to stop, because that's no good, right? So if everything is okay, kind of not feel so much of a pain, you can do some stretches now, then you have to start doing them, right? So when you have your full range of motion, then the next thing that you want to do is you want to activate different muscles around the knee, right? So this is the part where you will go through a rehab, and depending on who you see, and you have to be making sure that all muscles are fired up before you can try to go even higher in terms of resistance. So by the time when you can start doing some form of stretching or even activation work, you probably already not feeling so much of the pain, because for many people they think that they have recovered. But to me, if you are talking about functional, then you have to be doing something like squats. You have to be able to at least carry your weight. Even better, to be doing some barbell kind of squats. You have some resistance to make sure that you can actually carry more than your weight, which means that you are stronger, right? So it has to be to that stage. And for a lot of people who are not diligent, they may cross the point, the threshold where you go beyond pain, right? So you don't feel any pain here, then you stop doing things, and then you drop in strength, and then it comes back here again where you start to feel pain. And then this sometimes can happen through and fro quite a little bit. And that's why earlier on I say it depends on how diligent you are. So if you are diligent and you keep up with the work, and you're able to progress to the point where you can do a lot of resistance training, then your progress will be something like that. Okay, you just continue to raise your strength such that you will never hit this threshold anymore, and you continue to keep it there. Okay, so this can take about 4 to 6 months. Like I said, depending on how diligent you are. The quickest, the most diligent athlete out there, probably give them 2 to 4 months, right? Because they have to get back to game. And for most people out there, 4 months fastest. Again, like I said, depend on you. The more diligent you are, the faster the recovery time. And if you just want to take pain as your benchmark, then even faster, because you just have to ice yourself like mad. Okay, so yeah, that's how fast you take for your knee to recover after a total knee replacement. Right, so that's all I have for you today. So if you have any questions, please post them at the comment section below. Don't forget to subscribe to my channel, and I'll see you soon. Take care, bye bye.